Excellencies, ladies and gentlemen, thank you for the opportunity to participate in this event, which addresses some of the most important issues facing humanity today. The coronavirus pandemic is testing the social, economic, and political resilience of many countries and people around the world, but more importantly, developing countries. Many of these countries, especially African countries, already face challenges of extreme poverty, a lack of basic infrastructure and services, inadequate social protection systems, poor healthcare capacity, and pre-existing disease burdens. The pandemic is placing an additional burden on already constrained health systems. This global crisis has starkly highlighted the value of universal health coverage in responding to health emergencies and the need for robust health systems to save lives. South Africa fully supports the efforts of the World Health Organization to ensure that there is universal health coverage across the world. The reality that we must now confront is that the response to COVID-19 crisis has required countries to reprioritize the allocation of their resources by diverting crucial technical and financial resources from other critical areas. The health of women has been severely impacted through this reallocation, particularly in sexual and reproductive health services. There is a real danger that this will contribute to a rise in maternal and newborn mortalities, increased unmet need for contraception, and an unprecedented number of unsafe abortions and sexually transmitted infections. South Africa believes sexual and reproductive health services are crucial for a thriving society, including access to maternal health care and interventions related to gender-based violence. As countries of the world, we must ensure this pandemic does not worsen existing inequalities in society or impede the realization of the rights of women and girls. We must ensure that our response enables young people, in particular, to shape the world that will emerge from this crisis. It is significant that 65 out of the 168 Sustainable Development Goal targets refer to young people explicitly or implicitly, with a focus on their empowerment, their participation, and indeed their well-being. It is our desire that developing countries should have equitable access to safe and effective medicines and new health technologies as well. We call on the world to undertake the actions that are urgently needed to ensure collaboration on the development of knowledge, intellectual property, and data for existing and new therapeutics, vaccines, and diagnostics for COVID-19. I would like to commend governments around the world for their collaborative efforts towards advancing Sustainable Development Goal 3 on ensuring health and well-being for all. This includes a bold commitment to end HIV and AIDS, tuberculosis, malaria, and other communicable diseases by 2030. Fighting this global pandemic requires all of us to work together in collaboration with the United Nations as a united force. Indeed, we are stronger when we work together. I wish this meeting success with its deliberations. I thank you.